Assalamu alaikum. Thank you very much for joining us today. We have a few professionals from the counselling background, psychology and psychiatry. And today we're going to talk to you about the relationship between the different professions and thinking about how do we kind of classify mental illness. So I'm Dr. Saman Khan. I'm a consultant child and adolescent psychiatrist.
Assalamu alaikum, everyone. I'm Manaal. I'm an integrative therapist.
And I'm Sarah Gulamhusein. I'm a psychologist. All right. So just to kick off the conversation, I'm going to start with the first question, which is kind of thinking about the role of diagnosis and how, as you said, we classify mental health disorders and illnesses. So what do you think, in your opinion, is the role of diagnosis when it comes to mental health?
I think in working in psychiatry, it's a very important role. It's, I guess, the way diagnosis was developed over the years. We have two main classification systems that we're familiar with: the ICD, which is the International Classification of Disease, which we use here in the UK, and then we have the DSM, which is the Diagnostic and Statistical Manual of Mental Disorder, which is American-based. So using these two kind of manuals, what allows us is to make sure that somebody who's working in Hong Kong or China or Russia or Pakistan or America or the UK, we're all talking about the same thing. And that's why these were first developed. But over time, obviously, things have kind of developed and adapted. So I guess what are your thoughts about diagnosis? That can be either to Manaal or to Sarah.
Sarah, would you like to go first?
Yeah. So it is very interesting because I guess we're an international kind of panel here. So I'm from Kenya, even though I trained in the UK, and just noticing the difference in how people approach diagnosis in the different countries is very interesting to me, because there is a lot of emphasis on, as you said, the ICD and the DSM and getting that formal diagnosis done within the UK. But as you come out, there's a lot of people who haven't even heard of it. They don't even know what the DSM is or how we can classify any kind of mental health issue or disorder. And a lot of the times there's this label saying that, oh, my counselor told me I have this, so I have this. But was there an assessment and was there a formal diagnosis made? So I find that in that respect, the role of diagnosis is so very important, especially how you reached that diagnosis, on what foundation, has this person told you that this is what you have, this is what you're struggling with.
Yeah. Sorry, I think you make an excellent point about just mental health literacy. When we think of the people that are receiving these diagnoses, and when you think of clients, like, are they able to make sense of it? Does it feel like it's coming from a place that is professional and really kind of that diagnosis really thought through? I think when I think of the role of a diagnosis, especially as a therapist, and because I'm not really trained to make a diagnosis, my approach to hearing a client that says that they've come in with a diagnosis or that they want one is very much about looking at the symptom rather than the diagnosis itself. I think my training focused a lot on treat the symptom rather than the diagnosis, because I'm sure some of us might kind of see that a few people might have a similar diagnosis, but they might not exactly have the exact same symptoms, if I'm not wrong. So I think that's been really important for me in my practice to identify. But I'm also wondering, when we think of, the ICD, the DSM, because they're two different, manuals, do they agree with each other? Are there kind of disparities there? I'm curious.
I guess the way they were developed was very different. So ICD is an international classification of disease, so that it includes all diagnoses, not just mental illness. So you'll have diabetes in that, hypertension. So because it's very broad, it might not. It's not as detailed as the DSM, because the DSM is particularly to do with mental disorders. It actually was developed because the ICD was a more generic kind of classification. And the DSM I find a lot more useful because it kind of looks at different domains. So it's not just symptoms and signs, but it's also about how it affects their psychosocial functioning, which is obviously, as we know, just as important when we're dealing with a person. It's not just their symptoms, but it's how those symptoms affect them and their functioning. Diagnosis, over the last, I've been practicing psychiatry for more than 20 years now. And, the importance of diagnosis has changed over that time. There are periods when it was very important, then it wasn't, and now, and then it is again. And it's I'm a child psychiatrist, so sometimes it's very difficult to give a diagnosis at an early age because it is very much what the presentation is, it changes over time. So we're very reluctant in giving a diagnosis, because what we see at, say, age 10 or 12 or even 14 will be very different to how it would be when they're 18 or 19, sometimes. So I think it's important that we don't get too fixated on diagnosis. The good thing about in the UK is that we've had an act in Parliament to say that actually you don't need a diagnosis to provide learning support for children. Which again was in the past very important, that without diagnosis you wouldn't get the kind of extra or kind of in more intensive support in schools. And that's why we used to get a lot of school referrals that, does this child have ADHD or autism? But actually, if they're struggling in class, then they deserve to get that support. So that has been helpful. But obviously, because it takes time to shift things, we still get a lot of kind of professionals asking for a diagnosis, thinking that would kind of qualify for them for support. Obviously, in other areas like funding, for example, it's still very important. Social work funding only comes if you've got a label, so that becomes tricky as well. But I think it can be very helpful as well, because then the young person can understand what's wrong with them. And I've had patients who've been very grateful for example, an autism spectrum diagnosis, because they think, we've been different all our lives, and finally we understand why we're different. While other young people I've had who've been very upset by being given a diagnosis, because suddenly it's like, that's them, that's what defines them. And I guess that takes us to kind of our next discussion, what's the relationship between diagnosis and identity?
Yeah, I was just going to say that, because there is, for some people, I think there is that hesitancy that if I get a diagnosis, it may change things. It may make me, face things that I maybe am not ready to face, or whatever reasoning there is, they're a bit hesitant to do that. But then, for other people, it starts making sense, and they get that sense of relief that, now I understand better, like what's happening with me. So I don't know if we can actually say for sure whether diagnosis has a positive or a negative impact on how you see yourself, or how you identify yourself. That's what I was thinking. I don't know what you guys think of that.
Yeah, I think there's so much nuance there, right? Like for me, working with eating disorders, is like mainly eating disorders, I often see clients, that don't have a diagnosis but are accessing support for eating disorders. And for them, it's like, if I get a diagnosis, finally people will be able to see that I'm struggling. No one's really able to see the thoughts that a person experiences, or that kind of battle, that mental battle with food and exercise, because it can feel so hidden at times. So I do see the value in a diagnosis sometimes for clients to really just feel validated that, you know, I'm experiencing this and this is recognized by a professional, which means that even the help that I'm seeking feels, you know, worth it in some way. You know, equally, when I think of it for young people, it can be really challenging to make sense of a diagnosis because, you know, this is a part of their identity to some extent now, where you know, that feels like a label. And when you think of you know, things like social media, that we have become a very kind of all or nothing culture where, you know, this is the label that you have and this is the kind of hashtag that you're going to use now. And then if you're a young person, do you build your whole life around that? But also, what if that diagnosis doesn't hold true after some time? Does that mean that a part of your identity is taken away? So it's I find it really kind of, you know, from a client's perspective, a young client especially, to see that that's a very challenging process to go through. And as a therapist, you really have to sit with that and see how they make meaning of it. Yeah.
Yeah, that is very valid. And, you know, as you were saying that, I started thinking about how it's so easy to self-stigmatize ourselves, you know, when we get that diagnosis, and it sort of becomes a burden instead of, you know, as you're saying, sort of something that makes sense and something that you can then work on, you know, and improve your symptoms. So when you are in that situation where you are self-stigmatizing, I think it becomes even more crucial to continue that relationship with your doctor, your therapist, to kind of be able to explore that and move past that. You know, have you guys seen that in your experience as well?
Yeah, I think it can be really tricky, because it's really important to understand that the symptoms are only part of who they are, and to make them kind of understand that actually, but you know, there's nothing wrong as such. It's something that you're experiencing, but it's not forever. And the tricky thing is obviously that there are lots of people who would kind of follow the kind of illness behavior, I guess, you know, to explain all the things that have gone wrong, you know, because they've got this difficulty, and that's why it can be quite challenging as a clinician when you're kind of faced with that, and you try to explain to the, you know, I can try to think about it as a formulation rather than a diagnosis, and I think I find that more helpful. I think diagnosis only helps when we're thinking about treatments and management plans, but actually the person is not just one part. You know, they're parts of a whole. So it's important to think about all those different parts and try and kind of reflect that with the young person. And it can take a long time, and that's where therapy comes in very handy.
Yeah, I really like what you said about just acknowledging that this is a whole human being, you know, sitting in front of us, that, you know, the diagnosis, the symptom, you know, whatever that might bring is a part of that person. But, you know, also seeing them as an individual. Yeah.
Mm-hmm. And I guess that's why we see a whole spectrum. You know, human beings are not black and white. You know, we're all shades of gray. We're all on a spectrum. So it's and it's important to kind of acknowledge that when you were working with people. It's not an exact science, unfortunately.
Even though people may want it to be, or they might, you know, want to have a clear-cut answer when you're seeing a doctor, when you're seeing a therapist, when you're trying to get some help. I get that question a lot as well from my clients, that why is there no, like, you know, clear-cut answer? And it's like, because you are changing every day. You know, you have the tools and the resources inside of you. You have, you know, these sessions that are helping you. And so you're going to see that change. You're not going to stay in one place, you know, and it's just as Manaal was saying, you are a whole human being. There is more to you than the things that we're talking about here, which we may only be focusing on your symptoms or, you know, those behaviors that are not very conducive. But that doesn't mean that there's no positive aspect. That doesn't mean that there's no other parts of you, you know, that are helpful or that are just amazing.
Yeah.
A lot of people ask, what is the difference between, I guess, psychotherapy and counselling? So I guess you'd be best to kind of explain that.
Manaal, do you want to take that?
Oh, honestly, in the UK, I've seen the terms psychotherapy and counselling used interchangeably quite a bit. Yeah. I'm wondering if we can answer the question, what's the difference between maybe psychiatry and psychotherapy or / counselling? Like, you know, what does an appointment look like? Maybe we could walk everyone through what does a session look like for the three of us. Would you like to go first, Saman?
Yeah, sure. I work in a very busy clinic, so I don't do much psychotherapy. Unfortunately, I am trained in different psychological modalities, but the psychiatrist job just kind of becomes medication reviews or thinking about diagnosis. So yeah, it's a lot of it is about thinking whether somebody needs to be on medication, and if somebody's on medication, it's about, you know, if they're coping with it, and if they're having any side effects, whether it's working or not, whether we need to make changes, or thinking about diagnosis, you know, because as I said, in some things we really do have to, like in ADHD or ASD, in eating disorders, because the other services won't accept if those diagnoses are not given. So that is basically what my job is.
Wow. That's really helpful to know.
Yeah.
You know, just how detailed that process really is.
Yeah. For me, it's different with different clients, I would say. I do focus on client formulation, which we mentioned before is kind of different to a formal diagnosis, but similar at the same time. So I do kind of focus on that, and then kind of each session will be different. I try to keep overall goals, you know, depending on the client, but it's very much set by the pace of the client. So we'll try to achieve those overall goals, but every session kind of is different, and different therapies work for different people. If I had to give an example, I would say CBT works for a lot of different clients. I find myself going to that more often, but I've also used ACT, acceptance and commitment therapy, for a few people, especially people coming in with eating disorders as well. But yeah, so it is a range, you know, and I try to include faith in it as well, because a lot of my clients are Muslim, and I know faith plays such an important role. So I try to be holistic when thinking about it, because there are certain aspects there that do influence, you know, how we heal or how we recover from our struggles. So yeah, not very much medicine based. A lot of talking.
Yeah. No, but thank you for sharing that. I would say my process is, you know, quite similar to yours, in that, you know, every session does look very different. I always say, you know, the client needs to be like in the driving seat for this process, for it to really work, for them to feel like, you know, they're in control, especially when I work with eating disorders, control being such a huge aspect of it. But also, I think, you know, as I've, you know, gotten some experience, continued, I've realized that, you know, when we think of goals in therapy and what the client really wants, you know, whether it be in terms of support, getting a diagnosis, things of that sort, I've had a lot of clients who've just, you know, wanted to not really think about goals. And I think that can be a very difficult conversation for some, but at the heart of it, therapy is, a space for clients to exist in, and where they can have that kind of unconditional positive regard, where they don't have to meet a criteria to be there, which has been really helpful to kind of bring that into practice. Equally, I know that there are services where that isn't the case, where clients do have to meet a criteria to access support. And I think that can be really challenging sometimes as well, for them to feel like they have to be, for the lack of a better word, like ill enough to access something. And I guess that's where diagnosis sometimes plays a role with services, where they need that diagnosis, or they need that kind of confirmation that a client is deserving of that support. How does that sit with the two of you, that having to meet that criteria?
I think it's quite difficult because we at the moment, for example, we only see patients who've got moderate to severe mental illness, and then you've got a whole population who've got mild to moderate mental illness that do need some kind of help, and it gets really difficult because we're not even able to be near them at all. So it's it can be challenging, because obviously you want to help everybody, but you just don't have the resources.
Yeah, that is usually the case. And even in my practice, I come across a huge spectrum of people, and there are certain areas where I've not specialized, that I'm not unfamiliar with, and that means that referral is the next best option. But how to refer and who to refer to, that also presents another challenge, especially if the person is not willing to get a formal diagnosis. I've had clients who have said that, no, we don't want to do that assessment. We just want help, and I like the way that Manaal said it. There are certain conversations that are difficult to have, but ultimately it is their choice, how they want to proceed. And I have found that in that regard, the diagnosis very much does become a barrier for certain people to access that help. But then also, I'm wondering, and if we can kind of veer off, have you guys noticed a cultural preference when people are seeking therapeutic services?
Yeah, I think kind of ethnic minorities definitely are more reluctant to access specialist services. I think definitely there's still a lot of stigma there. Which is a huge barrier.
Yeah, I would say, being based in Dubai, when I think of clients accessing psychiatry and psychotherapy separately, there's a huge reluctance to access psychiatry when it comes to children and adolescents. So for young people, I think, because it's usually the parent, the caregiver, that's having to make that decision, their first kind of thought is, right, my child's going to be put on medication and I'm not okay with that. So there's the reluctance when it comes to children and adolescents. With adults, we are seeing more people access therapy, but also that oftentimes the way that kind of their mental health difficulties manifest is through, that kind of mind-body connection of aches, pains. So their first point of contact is a GP usually, which then makes me wonder, are GPs equipped to recognize those signs? Are GPs referring to the right places? And then it becomes a much bigger conversation. I'm not really sure if GPs in Dubai are allowed to prescribe psychiatric medication. I'm not sure if the rules are different here, but they would probably refer on to a psychiatrist if they recognize that. Yeah.
I agree with that because specifically here in Kenya, that would be, we don't really have a GP system, but everyone has their primary physician. And the first person your primary physician will kind of point you towards is a psychiatrist, even if it's something as simple as having a panic attack, having or experiencing anxiety and thinking that it's something else. And I've actually got a lot of clients coming to me then saying that we were just prescribed with anti-anxiety medication or antidepressants, and that's it. Didn't help, not really finding a conducive, way of dealing with what's happening. And that's why we've chosen to come to a psychologist or a psychotherapist instead. And I find that to be very interesting because do you think then that it's really important for physicians and for other medical professionals to understand the difference between psychiatry and psychology and psychotherapy and all these different fields and kind of present those options to the person, because a lot of the times that's what we're seeing is that they are being referred to someone who actually is maybe for their situation isn't being really helpful, or they're not being referred, which as well doesn't really help the situation.
Yeah, no, it's a huge problem in the UK. We've got like 8.3 million people being prescribed antidepressant medication since COVID.
Yeah.
So that's huge numbers, and it's the same across the globe. Actually, it's people, and the reason it's very simple. It's much easier to prescribe medication than it is to refer somebody to any kind of psychological therapy. The waiting lists, I don't know about Kenya and Dubai, but the waiting lists are huge over here. So rather than somebody waiting, 1 or 2 years to get help, the easy solution is to give an antidepressant. I'm not a fan of it. I do believe in prescribing antidepressant medication. For some people it really helps, but not for everybody, and not everybody requires it. So some people will be able to be helped by, as you say, CBT or other psychological modalities. But I think the pressure is, there is a lot of mental health difficulties that have come out from, post-pandemic, and there's not enough resources to manage them. Not enough, psychologists. We've got a huge gap in staff, so the easy solution is, unfortunately, prescribing medication. And then there's no follow-up. It's not great the way. GPs over here, some of them are trained in psychiatry. Not everybody, because it depends what training kind of program you follow. But there is the opportunity, and but as I say, it is the easier option.
So then, what do you think we can do about this overprescription problem, just as professionals in the field?
I think it's about kind of educating the masses. It has to be people, because they're the one who are going to seek help, I guess. And it takes a lot of courage in the first place to go and seek help, and then you're just kind of handed over a prescription. So it's not great advertisement for our profession, actually. But yeah, no, it's about, I think we need to equip our community in being able to help themselves. I think that's the first thing that that's my personal belief. You can agree to disagree, but I think we all have a responsibility to look after our own mental health. And there are so many opportunities, especially in the UK, things that you can get involved in that can help you in your kind of well-being. So there really is no excuse for us not to try and do that. And it shouldn't be like an outside thing, it shouldn't be that, no, I can't fix my problem, somebody else has to do it. We should be able to be, we should train our community to be more resilient.
Yeah, I just want to add to that, the answer Sarah's question of like, what can we actually do about this? what I see in my practice, which, really doesn't sit well with me sometimes, is, adult clients going in, explaining their symptoms, explaining what's going on for them, but there isn't really a proper assessment before medication is prescribed for them. I've unfortunately had clients come in and say things like, they've just been asked by a GP, why are you depressed? And that's a really, really heavy question to ask someone that is really looking for some support. So I think for me, it comes from a place of, can we do assessments that actually, make that prescription make sense? Can we see the full picture there? Like, what's really going on for this person? And equally, I can see that with the resources and time and all of those things, that it's a very complicated balance. But as a therapist, seeing that your client is being asked questions like that, it just is very hard to sit with that and be okay with that prescription, and have the client make sense of that really as well.
I agree. I definitely do. Just as you were saying that, I was really feeling it, because it does happen so very often. And I see it too. And I understand for some people the prescription works. It really is helpful. And that's great. But if you're still giving people blindly a prescription and then not following it up, that's not healthy. That's not really helping the situation. And I understand it takes a lot of time to get to, a position where you can make that decision. Okay, you would benefit from a prescription, or no, you would not benefit from a prescription. Or let's talk about it. That it takes time and effort to do that. But that doesn't mean that we can try to be rash about it. So I completely understand, like, and yes, education does really help. And I like how you said, Saman, I like how you said helping our people, or our communities even, just being more resilient, and prioritizing their mental health. So a lot of times people just don't do that. It's easier to blame others than actually work on what's happening, or how you're feeling, or how you're dealing with something. And it's much easier to take a pill than actually talk about, how do I resolve this? So we do very much see that, unfortunately. But in the interest of time, I think maybe we can kind of talk about how, in light of all of this, how can psychiatrists and therapists kind of work more effectively together? How can we kind of pool our resources together and make a difference?
I think it's very important going forward that we work together. I couldn't be able to do my job if I didn't have psychologists in my team. Definitely. I would always recommend, especially sometimes we do get patients who say, can I just have medication? And I say, no, you can't, because you haven't had your psychological therapy yet. So, going forward, I think it's really important that we work together and we understand where each is coming from. And I think today's kind of conversation has helped me, especially, think about that. So, no, definitely, I think it is really important that we do work together and we know when to pass or kind of refer to the other. I think that's important.
Yeah, I agree that just a strong referral system, that mental health literacy, and as you said earlier, Saman, that that resilience that we can bring in for the community to help themselves as well.
As Muslims, we kind of feel a bit shy. I don't know about you guys, but I do feel a bit shy coming in front of the camera and kind of sharing all these things. I have been I have been told in the past that I'm a know-it-all, and I try to like really be outspoken about it, but I do feel that there is an importance to do that, because that's the only way we can make sure that we're kind of working in the right direction, you know, and helping ourselves and each other as well. So
Absolutely.
a few more of these, inshallah.
Yeah. This has been a great discussion. Thank you so much to everyone for, you know, contributing and sharing your perspective. And thank you everyone for joining us today. This has been great. And inshallah, we look forward to seeing you in the next one.